You know what I hear all the time in my practice? Dr. Carter, I just can't catch my breath anymore. I get winded tying my shoes. Even laughing makes me feel like I need to sit down. I can't walk up a small hill without stopping 3 times. And when I ask when this started, they can't pinpoint it. Because lung decline doesn't announce itself with a bang. It whispers. It creeps in so slowly that by the time you notice, you've already lost months, sometimes years of capacity. Here's what most people don't understand. Shortness of breath isn't just about your lungs. It's about everything. Your energy, your independence, your ability to do the things you love. When your breath becomes shallow, your entire body starts to dim. Your brain gets less oxygen. Your heart works harder. Your muscles fatigue faster. Everything becomes just a little bit harder. But here's the truth that keeps me doing this work after all these years. This decline, it's not inevitable. Most of what we call aging in the lungs is actually disuse. It's inflammation. It's shallow habits that slowly become your new normal. The good news, the really good news, is that your lungs don't need miracles. They need movement. They need warmth. And most of all, they need rhythm, especially in the morning. And I'm going to show you exactly how to give them that, starting tomorrow morning, with just 5 minutes. But we're not going to stop there. I'm also going to tell you what to eat, what to drink, and what to avoid if you want to keep your lungs clear and strong. Because your breakfast can either block your breath or build it. So if you've struggled with shortness of breath, lingering fatigue, or you just want to stay active and independent as you age, stay with me, because it's never too late to get your breath back. What's really happening to your lungs? Let me paint you a picture of what's going on inside your chest right now, especially if you're over 60. After 60, your lungs naturally begin to lose elasticity. Think of a rubber band that's been stretched too many times. It doesn't snap back quite the way it used to. That's your lung tissue. The chest muscles that support breathing, they weaken. The diaphragm, that powerful muscle that should be doing most of the work of breathing, it becomes stiff. And the airways themselves, once open and clear, they narrow just slightly. Not enough to alarm you, not enough to send you to the emergency room, but enough to steal your energy, one step at a time. And here's what really gets me. This is where most people get completely blindsided. They feel tired, but they don't connect it to their breathing. They think it's just age, or poor sleep, or maybe they need more vitamins. Maybe it's their thyroid. Maybe they need more iron. But breath? It's almost never the first guess. I've seen this pattern hundreds of times in my practice. A patient comes in complaining of fatigue, constant, nagging fatigue. We run tests. Everything looks normal. Blood work is fine, heart is fine, thyroid is fine. But when I watch them breathe, really watch them, I see it. Shallow, rapid, all in the chest. The diaphragm barely moves. And when I ask them to take a deep breath, they can't. Not because they're sick, not because there's disease, but because they've forgotten how. Their body has slowly, quietly shifted into a pattern of shallow breathing. And that pattern has become their new normal. And here's the part that should really concern you. It's not just about feeling winded when you climb stairs. Oxygen fuels everything. Your brain needs it to think clearly, to remember names, to process information. Your heart needs it to pump efficiently. Your muscles need it to move without cramping. Every single cell in your body depends on it. When your breath becomes shallow, when those oxygen levels drop even slightly, your entire system starts running on low power. Think of it like this. If your phone battery drops to 20%, everything slows down. Apps take longer to open. The screen dims. You can still use it, but it's not the same. That's what happens to your body when your lungs aren't delivering enough oxygen. You can still function, but everything is just a little bit harder, a little bit slower, a little bit more exhausting. I've watched patients who seemed perfectly healthy, no diagnosis, no chronic illness, just slowly fade. Not because of disease, but because their breath was shrinking, unnoticed, uncorrected, stealing their vitality, breath by breath. And the worst part? They thought it was normal. They thought it was just what happens when you get older. But that's the lie we need to stop believing. Because unlike so many things in aging, unlike joint damage or memory loss that's already progressed, this one is fixable. Completely, totally fixable. And it doesn't require surgery or expensive medications. It requires attention. It requires consistency. And it requires you to remember something you've been doing since the day you were born. Breathing. The morning breath. Your first act of strength. Now let me tell you something that might change the way you think about mornings forever. Your first breath of the day is not just a reflex. It's a message. And your entire body is listening. Most people wake up, and what do? They reach for their phone. They check the news. They look at emails. They scroll through social media. They jump straight into stress mode. And their breath? It stays shallow, rapid, locked in the chest. And that sends a signal to the nervous system. We're under threat. We need to stay on alert. Danger could be anywhere. But here's what you need to understand. A deep breath, a deliberate breath, a conscious breath, sends the opposite message. It says, we are safe, we are ready, we are in control. There is no emergency here. After 60, your body listens more carefully to that message and responds more dramatically. Your nervous system is more sensitive. Your stress response is quicker. But that also means your relaxation response can be deeper if you know how to activate it. This is why I tell every single one of my patients, begin your day with your lungs, not your phone. Before you check anything, before you worry about anything, before you start your mental to-do list, check your breath. That's your first act of strength. And here's what makes this so powerful. Breathing is the only system in the body that is both automatic and controllable. Think about that for a second. You can't control your heart rate directly. You can't tell your liver to detoxify faster. You can't consciously speed up your digestion. But you can control your breath. That means it's your bridge. Your bridge between your conscious mind and your unconscious body, between what you can control and what usually runs on autopilot. And when you take control of it, even for just a few minutes, you're telling your entire system, we are not in danger. We are in charge. We're starting this day from a place of calm. And that single message, it lowers cortisol, the stress hormone that ages you faster than anything else. It improves circulation, bringing fresh blood to every part of your body. It activates your parasympathetic nervous system, the part responsible for healing, for digestion, for repair, for all the maintenance work your body needs to do. So imagine this. You wake up tomorrow morning. You don't rush. You don't immediately start thinking about everything you have to do. You sit up slowly, and before you do anything else, you breathe. Intentionally, deeply, deliberately, for just 5 minutes. You've just reprogrammed your entire system before your feet even hit the floor. You've told your body, today, we're starting from a place of strength. A 5-minute ritual that opens your lungs. All right, let me walk you through this ritual step by step. This is what I teach every patient over 60, and it's what I do myself every single morning without fail. Step 1. Belly breathing. Sit up slowly in bed. Don't rush. Take your time. Place one hand on your belly, right below your rib cage. Place the other hand on your chest. Now breathe in through your nose for 5 seconds, slowly and steadily. The goal is to feel the belly rise, not the chest. That's how you know you're activating the diaphragm, the muscle that should be doing 80% of the work of breathing. Your belly should push your hand out while your chest stays relatively still. If your chest is rising and your belly isn't moving, that's chest breathing. That's what most people do. That's what we need to change. Hold that breath for just a moment, 2 seconds. Then exhale through your mouth for 7 seconds, slow and controlled. Feel the belly soften. Feel all the air leave completely. Don't force it, but don't hold back either. Let it all go. Repeat that 5 times. 5 deep belly breaths to start your day. This alone, just this simple exercise, retrains your lungs to open fully. Something most people stop doing after 60 without even realizing it. Over time, you've trained your body to breathe shallow. Now we're training it to breathe deep again. And I know what you're thinking. Dr. Carter, I am breathing deeply. But here's the thing. Most people think they are, but when I watch them in my office, it's all chest, all tension. The shoulders rise, the neck tightens, the diaphragm barely moves. Chest breathing becomes the default when we live in chronic stress. But diaphragmatic breathing, belly breathing, brings the lungs back into their full range and signals the body to relax. That's the difference. That's what we're restoring here. Step 2, window breathing with arm raises. Once you've done those 5 belly breaths, I want you to stand up and walk to a window. Open it if you can, even just a crack. Let some fresh air in. Cold air, warm air, doesn't matter. Just fresh air. This does something psychological too. It signals to your brain, we're waking up. We're greeting the day. Stand comfortably, feet about shoulder width apart. As you inhale slowly through your nose, raise both arms gently overhead. Reach up, but don't strain. As you exhale through your mouth, let your arms fall slowly back to your sides. This simple movement stretches the rib cage and invites more space into the lungs. It also engages those intercostal muscles, the small muscles between your ribs that make deeper breathing possible. These muscles weaken with age and disuse, but this movement wakes them up. 5 slow breaths like this, and you've activated your entire chest. You've told your lungs, we're opening today. We're not staying compressed. Step 3, side stretches for lung expansion. Finally, standing in the same spot, raise your arms above your head. Clasp your hands together if that's comfortable, or just keep them extended. Now, gently lean to the left, feeling a stretch along your right side. Hold it for 1 full breath cycle. Inhale and exhale. Then come back to center and lean to the right, stretching your left side. 1 full breath cycle there too. Repeat this 3 times on each side, always moving slowly, always keeping the breath steady and controlled. This movement helps clear out overnight stagnation in the lungs. While you sleep, especially if you sleep on one side most of the night, fluid can settle. Airways can compress slightly. This stretch opens everything back up. You might feel a little crackle or tightness at first. Some people even feel a slight pulling sensation. That's okay. That's completely normal. That's the lungs waking up, remembering what full breathing feels like. Unless there's actual pain or dizziness, that tightness will fade as your body remembers this movement. The whole thing, from belly breaths to side stretches, takes 5 minutes. Maybe 6 if you're moving really slowly, but over time, over weeks and months of consistency, it restores what aging quietly takes away: lung capacity, oxygen flow, energy, clarity, Vitality. Why this works when nothing else does. Now I know some of you are thinking, Dr. Carter, this sounds too simple. How can 5 minutes in the morning make that big of a difference? I've tried breathing exercises before and didn't notice anything. And I get it. I really do. In medicine, we're trained to look for complex solutions. Pills with complicated names. Procedures with technical descriptions. But here's what I've learned after decades of practice. After seeing thousands of patients, the body doesn't respond to complexity. The body responds to rhythm. 5 minutes every morning. Same time. Same sequence. Simple. Quiet. Consistent. That can do more for your lungs than a drawer full of supplements or a medicine cabinet full of inhalers. Because here's what people forget. When you open your lungs in the morning, when you consciously, deliberately fill them with oxygen, you're not just preparing to breathe. You're preparing your entire system for the day. You're preparing to move, to think, to feel, to engage with life. Poor oxygen flow affects everything, and I mean everything. Your memory gets foggy because your brain isn't getting enough fuel. Your digestion slows down because your gut needs oxygen to function properly. Even joint pain can worsen because inflamed tissues need oxygen to heal. It's all connected. Your body is not a collection of separate parts. It's one integrated system, and oxygen is what keeps that system running. And if you've had COVID or pneumonia or bronchitis in the past, these kinds of gentle routines become even more critical. I can't tell you how many patients have come to me months after recovering from respiratory illness, still dealing with shortness of breath, still feeling fatigue, still experiencing chest tightness that won't go away. The medical tests come back normal, the lungs look clear on x-rays, but they still can't breathe the way they used to. And this ritual, this simple 5-minute practice, helps reset the lungs, retrain the breathing muscles that got weak during illness, and reduce that lingering inflammation that nobody can quite explain, but everyone can feel. And the mistake most people make is thinking they have to push hard to recover. They think healing means forcing their body to do more, do better, do faster. But the lungs, they don't respond to force. They respond to kindness, to patience, to gentle, consistent invitation. Breath is not effort. Breath is invitation. You're inviting your lungs to open. You're inviting your body to relax. You're inviting healing to happen naturally, the way it's supposed to. What to eat after you breathe. Now, once you've done your morning ritual, once you've opened your lungs with breath and movement, the next step is just as important. What you put into your body. Because the lungs, like every organ in your body, respond to what you feed them. Food is information. Food is instruction. And after 60, your body listens very carefully to what you're telling it. I always tell my patients, start with warmth. Not cold juice, not iced water, warmth. Warm water with lemon is my first recommendation. Simple, inexpensive, and incredibly effective. It helps thin mucus that might have built up overnight. It stimulates the diaphragm gently, and it wakes up your digestive system without shocking it the way cold drinks do. Cold contracts. Warmth opens. Remember that principle. Ginger tea is another excellent choice. Ginger is a natural anti-inflammatory, and inflammation is one of the biggest enemies of healthy lungs. It also improves circulation, which means more oxygen-rich blood reaching all your tissues. If you want to add honey, go ahead, but make sure it's raw honey, not the processed kind. Turmeric tea is even more powerful for inflammation. Turmeric contains curcumin, which has been shown in studies to reduce airway inflammation and even help with conditions like asthma and COPD. If you're making turmeric tea, add a pinch of black pepper. It sounds strange, but black pepper increases the absorption of curcumin by up to 2,000%. no pepper, and most of that turmeric just passes through your system unused. And if you're eating breakfast, and I recommend you do, keep it simple and warm. Warm oats with cinnamon and a handful of pumpkin seeds. That's lung nourishment right there. The oats provide sustained energy without spiking your blood sugar. The cinnamon has anti-inflammatory properties and helps regulate blood sugar. And pumpkin seeds, they're rich in magnesium, which helps relax the airways and supports healthy lung function. You could also add some walnuts. Walnuts contain omega-3 fatty acids, which reduce inflammation throughout the body, including in the lungs. Or some berries for antioxidants. Blueberries, strawberries, whatever you like. Antioxidants protect lung tissue from damage. The principle here is simple. Breath is light, so your first meal should feel that way too. You don't want to start your day with something heavy that weighs you down, makes you sluggish, makes your body work hard just to digest it. After 60, food isn't just fuel, it's instruction. It tells your body how to function, how to heal, how to breathe, how to begin the day. If your first bite says slow down, settle in, open up, your lungs follow that lead. And when your lungs are open, everything else opens with them. Your posture improves, your energy rises, your mind clears. Now, let me quickly tell you what to avoid. Dairy products in the morning, especially if you have any respiratory issues. Milk, cheese, yogurt, they can increase mucus production in some people. Not everyone, but many. If you wake up with a lot of phlegm or congestion, try cutting out dairy for a week and see what happens. Also, avoid processed foods, sugary cereals, pastries, anything that causes inflammation. Sugar is one of the worst things for your lungs. It suppresses immune function, increases inflammation, and can make breathing problems worse. And if you're a coffee drinker, that's fine, but don't drink it on an empty stomach. The acidity can cause problems. Have your warm lemon water or tea first, then your breakfast, then your coffee, if you want it. Your lungs and your stomach will thank you. That's the real morning medicine. Not a pill, not a miracle supplement that promises to solve everything. Just breath, movement, and warmth. Simple, ancient, effective. The ripple effect. What happens when you commit? Let me tell you what actually happens when someone commits to this routine. Because I've seen it hundreds of times now, and the pattern is always the same. In the first week, they notice small things. They're not as winded going upstairs. They can have a full conversation without feeling like they need to pause for breath. They laugh without feeling like they need to sit down immediately after. These seem like small victories, but they're not. They're signs that the body is responding, that the lungs are opening, that oxygen is flowing better. By the second or third week, something deeper starts to shift. Their energy improves, not dramatically, not like flipping a switch, but steadily. They wake up feeling more rested. They get through the afternoon without that crushing fatigue they've gotten used to. They sleep better at night because their body is actually getting the oxygen it needs during the day. And here's what really gets me, what really makes this work worthwhile. Their mood lifts. Depression and anxiety are so common in older adults. And yes, there are many factors, but one that's often overlooked is oxygen. When your brain isn't getting enough oxygen, everything feels harder. Everything feels heavier. But when you restore that oxygen flow, when you give your brain what it needs to function properly, the world becomes a little bit brighter, and then they start moving more. Not because I told them to, not because they're forcing themselves, but because moving doesn't feel like such a burden anymore. They go for walks. They play with their grandchildren. They do activities they'd given up on because they thought they couldn't anymore. Little by little, breath by breath, they rebuild the rhythm that aging tried to steal. I've had patients in their 70s and 80s who were told by other doctors to take it easy, to slow down, to accept their limitations. But instead, they learned to breathe with purpose. They learned this simple 5-minute ritual, and their energy returned. Not overnight, not magically, but steadily, surely, consistently. Because that's the secret of daily habits. 5 minutes of intentional breathing becomes 10 minutes of walking. A calm morning becomes a stronger afternoon. A stronger afternoon becomes a more restful night. And over time, that compounds into something much bigger. Not just lung health, not just physical improvement, but vitality, independence, the ability to live life on your terms, not on the terms your aging lungs tried to dictate. Final thoughts: your breath, your life. So here's what I want you to take away from today. Most of the decline I see in older adults, most of the fatigue, the breathlessness, the slow fading of vitality, it's not from disease, it's from disconnection. They've disconnected from their bodies. They've stopped paying attention to the basics. They stop moving because moving is hard. They stop stretching because they think they're too stiff. And most importantly, they stop breathing fully, not because they can't, not because there's irreversible damage, but because no one reminded them how, because no one told them it mattered. This ritual is that reminder, not just to your lungs, but to your whole self. It says, you are still here. You still have strength. You still have capacity. Let's begin again. Let's remember what your body can do when you give it attention, when you give it rhythm, when you give it the simple gift of a full breath. And when you start each day with breath, when you make it your first priority before anything else, you're not starting from a place of fear or limitation. You're not starting from, what can't I do anymore? You're starting from a place of power, from what is possible today. That's how vitality returns, not with noise or pressure or complicated protocols, but with quiet consistency, breath by breath, day by day. So tomorrow morning, before you check your phone, before you start your to-do list, before you jump into the chaos of the day, I want you to try this. Just 5 minutes. Sit up slowly, place your hands on your belly, and breathe. Really breathe. Do it for a week. Notice what changes. Notice how you feel. Notice what becomes easier. And then keep going. Because this isn't a one-time fix. This is a practice. This is a way of living. This is how you honor the body that's carried you this far and will continue to carry you forward. If you want to feel alive after 60, if you want to maintain your independence, if you want to have the energy to do the things you love, the place to start is simple. Honor the breath that keeps you here. Thanks for watching Dr. Carter's Senior Health Guide. If this resonated with you, if you found value in this, please hit that like button, subscribe to the channel, and share this with someone who needs to hear it. Someone who's struggling with their breath, someone who's accepted decline as inevitable, because it's not, and they need to know that. I'll see you in the next video. Until then, breathe deep and stay strong.